Hello everybody. In this video we continue covering appendicular skeleton and we will talk about low extremities. As always, I have the list that you can download from Canvas where you have all the bones and their features that you need to know. So over here in front of me, I have all the bones that I need to show you bones of the low extremities. So this is the biggest and the strongest bone of your body. That's a femur, tibia, fibula, patella, and the whole set of bones of the foot. Okay, so I'm gonna start with femur. So femur, that's a proximal end, that's a distal, right? It's over here. Proximal and distal. And on the proximal end, I have the head, right? This round structure, and the neck. This is surgical neck over here. This is the area that most accessible to breakage, right? And this head forms a joint with the os coxa bone, right over here. Right. So remember this acetabulum. So acetabulum and the head of the femur form this hip joint, ball and socket joint. Okay, now if you look at the proximal end again, you see this bumpy area here and this one. This is called trochanter. So we have greater and lesser trochanter. So that's a greater trochanter, and this is lesser trochanter. So let me also show it to you on this side. Greater trochanter and lesser trochanter. Okay. Now on the posterior side, the surface is pretty rough, and this rough area is called linea aspera. Linea aspera. And kind of like upper part, this part of the linea aspera is called gluteal tuberosity. And this is where gluteal muscles are attached. So in the distal part, you have patellar surface, and this is where patella would be attached. And on the posterior side, you can see those condyles. And where we have head, this is medial part. So that will be medial condyle, and this one will be lateral condyle. And between them, will be intercondylar fossa or intercondylar notch. So that's femur. Let me put it away for a second. Next bone is tibia, right? And tibia has like here's a bigger part and a smaller part. So this bigger part is a proximal, and kind of like smaller end is a distal end. So on the proximal end, we have this part and this part. This is also called condyles. Medial condyle and lateral condyle. And between them, this is this part of the bone that kind of like goes up, elevates, right? This one. And this is called intercondylar eminence. Now, tibia form joint with the femur, right? That will be your knee joint, right? So for femur, and again, you see this is the head. So this is medial condyle, lateral condyle of the femur, and this is medial condyle and lateral condyle of the tibia. Right? Okay. Now that was our proximal end. On the distal end, you will see this bony structure, right? And this is called medial malleolus. And you can palpate your medial malleolus on the medial side of your ankle. And this is called inferior articular surface. And this part articulate with talus of your foot, right? Like this. Also, the last part you need to know is this on the anterior surface, this bumpy structure. This is called tibial tuberosity. And this is also the part you can palpate on yourself just below your knee. So that's tibia. Fibula. So fibula is a thinner bone, not ball, thinner bone, and it has two parts. One part is kind of flat, so this one, and one is more round. The one that is round, this is the head. Oh, makes sense. Head supposed to be round. And the one that is flat over here, it's called lateral malleolus. So remember, on a tibia, we have this medial malleolus, and then on a fibula, right? Okay, let me try to make this joint for you. This joint, I can never handle it, right? But that's how it would be, right? So this is medial malleolus and this is lateral malleolus. And if I have a foot, right, here, the part of the ankle joint. And tibia and fibula also form two joints. Proximal tibia fibula joint would be like over here, and distal tibia fibula joint on the distal part. So that's tibia and fibula. Now patella. So this is a femur, that's a patella. And patella just fits over here. Yeah, this way. Right, on the patella surface. And patella has apex. So here's the apex. And patella has two facets, articulating facets. It's a little bit on the posterior side, but I'll show you to you in the middle. Just make sure this is medial and this is lateral, right? So when I move it, right, that's gonna be lateral and medial facets. Okay, and now the last set of bones that we need to cover are tarsal bones that make your foot. So we have, tarsal, metatarsal, the whole bunch of bones, tarsal bones, metatarsal, and phalanges that make your foot. Okay. So a foot has 7 tarsal bones. Right. If you remember carpal bones, over here that make your wrist, we have 8 carpal bones, and we have one less, 7 tarsal bones. Now the bigger one is calcaneus, right? So that's a calcaneus. That's your heel. Then superior to it is talus. Right? Now this bone over here is called navicular, and this big one look like a cube. This is cuboid. Okay, so again, calcaneus, talus, navicular, and cuboid, and then I have 1, 2, 3 more bones, and they all have the same name, cuneiforms. Thanks goodness, right? This is medial cuneiform on the side of your big toe, medial cuneiform, intermediate cuneiform, and lateral cuneiform. Right? So that's 7 tarsal bones. Then we have 1, 2, 3, 4, 5 metatarsal bones, and we abbreviate them MT. And this is MT1. Again, this is your big toe or hallux. So MT1, MT2, MT3, MT4, and MT5. And then we have your toes made of phalanges. And the big toe has only 2 phalanges. The rest of your toes have 3. And we have proximal row of phalanges, middle row of phalanges with the exception of big toe, and distal row of phalanges. Phalanges is plural, phalanx is singular. So let's say if you need to identify this one, this will be what? Proximal phalanx of MT3. Okay, so that's it for lower extremities. And lower extremities are part of the appendicular skeleton. Thank you for watching, and I hope it was helpful.